Hello, I am Dr. Jung-woo Kwon, a neurosurgeon at Wooridul Spine Hospital. Today, I would like to discuss the natural healing of herniated discs. To begin with the conclusion, studies report that natural healing occurs in up to about 70% of cases within 6 months to 1 year after disc herniation. Before going further, let us briefly review what an intervertebral disc is and what disc herniation means. An intervertebral disc consists of two main parts, the outer annulus fibrosus and the inner nucleus pulposus. When people say a disc has ruptured or slipped, it does not mean the annulus itself has come out. It refers to the nucleus pulposus breaking through the annulus fibrosus. Depending on the extent of protrusion, disc herniation is classified into 4 stages. When the nucleus slightly bulges, it is called a disc bulge. When it protrudes further and compresses the nerve, it is called a disc protrusion. If it penetrates both the annulus fibrosus and the posterior longitudinal ligament behind the disc, it is classified as a disc extrusion. When the extruded fragment completely separates from the remaining nucleus, it is called a sequestered disc herniation. Natural healing occurs through macrophages, immune cells that recognize the extruded nucleus pulposus as foreign material and gradually resorb it. For this reason, conservative treatment is usually recommended first to allow time for this natural process. However, more aggressive treatment may be necessary in certain situations, such as severe motor weakness, progressive sensory loss, bowel or bladder dysfunction, or persistent symptoms despite adequate conservative care. In these cases, active intervention is required. One minimally invasive option is uniportal endoscopic discectomy, in which only the herniated disc material is removed through the intervertebral foramen. This technique is commonly performed at Wooridul Spine Hospital. Disc herniation usually does not occur in completely healthy discs. It often develops in discs that have already undergone degenerative changes, and spinal stenosis may coexist. In such cases, removing hypertrophied pathological ligaments contributing to stenosis and reconstructing spinal ligaments with an artificial ligament can be effective. Biportal endoscopic surgery may also be considered, depending on the individual case.
Is recurrence common even after natural healing?
Disc herniation does carry a risk of recurrence. Because the nucleus pulposus has penetrated the annulus fibrosus, a structural defect remains. This weakened area makes it easier for disc material to protrude again through the same site. Therefore, even after natural healing or treatment, proper spinal care and caution are essential.
Does a decrease in disc size on MRI mean natural healing?
If follow-up MRI shows a reduction in disc size, this generally reflects natural resorption. However, imaging findings are less important than clinical symptoms. Natural resorption refers to macrophages absorbing the extruded disc material. Natural healing should be evaluated together with symptom improvement. The most important factor is whether the patient's symptoms have improved. If symptoms have clearly improved, the condition can be considered naturally healed. This was Dr. Jung-woo Kwon, neurosurgeon at Wooridul Spine Hospital. Thank you.